As medical people, we are trained to look for the problem, think about the solutions, and come up with a plan. When we're dealing with unplanned pregnancy, I always try and take that step back and get my listening skills tuned. Something I learned from Children by Choice actually some years ago is the concept of women as the experts in their own lives. And so I think if we can let women tell us their story, tell us their solution, then often we don't have to say a lot. So if a woman clearly has worked through her process of an unplanned pregnancy and her solution to it, then I may not need to say a lot. So I think it is really about listening.
To my mind, the most important, most critical thing in this setting is when you're talking to a patient who presents with a positive pregnancy test and comes to you, is to not say, well, congratulations, what good news, that's wonderful. Because never ever assume what a pregnancy means to a woman. So you must always, I would encourage everyone to say, well, so your test is positive, how do you feel about that? Because we should, saying congratulations to a mother of 6 children in a domestic violence situation is the last thing she needs to know. She wants to. And it also, by congratulating, it separates the woman from the practitioner in that she automatically assumes that he or she will be promoting a continuation of that pregnancy. So from med students to gynecologists, I would encourage us all to wait until you've found out from the patient herself how she feels about this unplanned pregnancy.
It is about listening for things that may make you concerned that there is some difficulty in that decision for that woman. The things I have particular red flags for me are around where her values may be really in great conflict with this decision, where there may be some coercion, so reproductive coercion, where her decision is being influenced by somebody else, by a partner or sometimes a parent. So the things that I am listening for, and I guess I may structure things more differently, is where I think there could be a benefit for the woman having some deeper conversations around her choice. So depending on what that is, that may be something I will just go through and use some sort of very basic medical kind of counselling skills, active listening, reflecting back, those sort of things. But I will often at that point at least offer referral to a counselling service. So in the service I work in, I might offer to refer to one of our counsellors, or I may refer the woman to call Children by Choice. Or sometimes if there's time, it may be just about saying, did you want to come back and talk about this later? And this is all relevant in terms of medical abortion, in terms of the timing.
When talking to your patient about medical termination or surgical termination of pregnancy, it's very important to be honest and open. And interestingly, the NICE guidelines in the UK recently underlined the fact that it is important that you offer the patient both options of a surgical and medical termination by providing equal informative information about options without any bias. And that can be tricky because we all do have little internal biases or thoughts that we have about one process or the other. But it is very important that choice is the patient's choice and that they're given the equal and balanced information to make that choice.
I think the other thing when we talk to women in a medical context about their unplanned pregnancy and about decisions around abortion is to normalise it. So I think one of the fantastic things about providing abortion, or providing a discussion at least in general practice, is we can really be clear in saying this is common. that a decision around unplanned pregnancy is common. Unplanned pregnancy itself is common, and having an abortion is common. So just providing that sort of space can be incredibly powerful. It's one of those things that I never fail of surprising myself to realise how something that seems so normal to me, and so that I know that is a common thing. The relief that some women feel when you actually provide that normalisation, and maybe sometimes even some statistics, so that at least 1 in 4 women will need to have an abortion at some stage in their reproductive lives. We have up to 40 years of reproductive life where we're managing our fertility. So things like that can sometimes help.